Welcome back to County Connection. For this segment, we're going to be talking about preventing prescription drug abuse. And I have with me Laurie Blackwell from the Healthy Futures Initiative, housed in Summit County Youth and Family Services, and Kathy Davis from Mind Springs Health, that works on mental and behavioral health resources for our community. Welcome, ladies.
Thank you.
Thank you. So let's start off by talking about how big of a problem prescription drug abuse is in Colorado.
Okay. A startling statistic for me is, and we call it a prescription drug epidemic at this point.
Oh, wow.
And the most startling, nearest statistic we know about is 35 people in Colorado every year are killed because of a prescription drug overdose. That's one a day in Colorado. And that takes my breath away.
Yeah.
So that's kind of where it keeps us grounded, and it keeps us understanding that we need to take this way more seriously than we have been in the past.
Right.
I think social norms are that people have prescription drugs in their medicine cabinet, and they're unused, they're even expired. They share them with friends or family, and their children see that. And so we have this idea that prescription drugs are safer than other drugs, which is also
so
not
familiar
true.
with them. And,
yep. And a person can be hospitalized, they can become addicted, and they can die.
Right.
And that we need to, as adults, have a different framework as to how we handle drugs, and how we approach prescription drugs.
All right. Kathy, what are we seeing locally in terms of addiction and abuse of prescription drugs?
Well, we're seeing more and more prescription drug abuse. And it kind of comes from two different angles. We have people who are prescribed prescription drugs. They take them as prescribed. And over time, they start taking more and more. And it becomes a situation where they're addicted to those drugs. We also see where people are having access to those drugs through friends or family, and they're taking those drugs from medicine cabinets, as Laurie said, that aren't being used. And so that's one of the reasons that we're here today, is we really want people to understand that if you're prescribed a drug that is a sedative, a painkiller, an antidepressant, a stimulant, anything that could be harmful to someone, you really have to be responsible with it. And you need to track it, and you need to keep it secure. And when you're not using it any longer, you need to dispose of it correctly.
Okay, so there are three key strategies that we focus on in terms of preventing abuse and misuse of prescription drugs. So can you break down those three key strategies for us, Laurie?
Yeah, I think of it as a three-legged stool, really. Is when you are prescribed something, use it safely. So monitor what you have at home and what you've been prescribed, and also if you have refills, monitor those. Know what you have in your cupboard, or your, hopefully it's secure and locked. And that's number two, is that we need to store it safely. We need to think of this as like jewelry or money. You need to lock it, put it in a drawer that's locked, put it in a cupboard that's locked, have a lockbox. Don't leave any prescription drugs freely available to anyone else in the family except the person they're prescribed for. And then we need to dispose of them when we complete the prescription. Not hold on to them in case you have pain another day, which is really the way we think about it. Oh, I should save that for later. The minute you're done with that prescription and you don't need it anymore, dispose of it. And so there's rules about that one too.
Right. And it also kind of even gets back to the first strategy of responsible use, that you need to use it as it's directed. As it's directed. For a particular cause that your physician prescribes it for.
And the physician may say, take it all the way to the end. If you don't need it anymore and you have leftovers, that's where we want to say, don't put it in the toilet or the sink ever, because it goes into our water system, and that's really unsafe. And don't put it in the garbage, especially in front of your kids, because if a young person really wanted access to your pills and they see you discard them in in the garbage, they're going to take them. And we have two upcoming events, one in April and one in May, for people who want to discard prescription drugs that they have on hand. The first is the 9 Health Fair, which is Saturday, April 18th from 7 to 12 at the high school.
Great. And that is a great, the event itself is much larger than that, but what a great opportunity if you're getting your blood pressure checked and your weight and all kinds of other things to do with your health. Why not round up some of those expired prescriptions?
It's a fabulous event. It's just a great event. There's so much that's happening. And that's, I think, where traditionally people have said, okay, if I still have something, I'll take my prescription meds there. We've also had 2 Summit County events where we've taken a whole lot of drugs. The first one was 100 pounds. I don't know what the recorded amount was for the last one.
I think that one was, the second one was about 95 pounds.
95 pounds of prescription drugs. I'm so happy about that.
Yeah.
And then we have another of those exact same events in May on the 16th from 8 to 12 at the Bus Barns. So
fantastic.
Yeah. So that's a way to get those out of the house. But previous to that, we'd really like people to count their meds. We want them to go and buy a lockbox at a hardware store, or get a locking system that you can put on your drawer, to keep that stuff away from other people who might want to use it.
Right.
Yeah.
Well, and I know through conversations that you and I have had previously that Colorado teenagers in some various surveys have reported that it's easier for them to get their hands on prescription drugs than it is beer. So in terms of substance abuse among adolescents, that kids are saying that it's really easy for them to get a hold of this stuff.
Absolutely. And I think one thing also that we can help people understand is that they can advocate for themselves and their family members when they're being prescribed these drugs. So if you are working with your doctor and you're having a surgery or some sort of procedure, for example, that you have a pain medication prescribed to you, be talking to your doctor at that point about what the plan is, how long you should be using those medications, and how you're going to be tapering off of those medications. It's important to have that conversation before you start taking those medications, if at all possible.
Okay.
That's a great point.
So Kathy, talk a little bit about some of the resources that MindSprings has available to people who may be concerned about addiction or to address some of these issues in the community.
Well, MindSprings Health in Summit County has a pretty extensive substance abuse program. We have individual and group offerings for people who may be looking at exploring what drug abuse looks like for themselves. We also have groups and individual counseling that can help someone who has an identified problem and they want to get sober. So they want to be clean from any drugs or alcohol. And so we can help people, whether it's harm reduction or abstinence, and really help them get to the goals that they want around that. Our website is a great resource for that information, as well as educational opportunities that we have in the community around substance use and mental health issues.
Excellent. And tell us what your website is.
The website is mindspringshealth.org.
All right. And how might people get in touch with you over the phone?
Our phone number at the Frisco office is 668-3478. And people can walk into our office, and see a counselor. So when it's convenient to them, they can come to our offices and we can make sure that they get connected with a counselor right away.
Excellent. Yeah. All right. And Laurie, can you tell us about some of the resources that you find particularly helpful as people are trying to learn more about this issue, or maybe have kids at home, or need some ideas on some of those 3 strategies that you talked about?
Yes. We have a brand new website, a Colorado website called Take Meds Seriously. So it's www.takemedsseriously.org. It's in English and Spanish.
Great.
We also have, for parents, resources on our website, which is www.summithealthyfutures.org.
Fantastic. Yeah. And then if folks want to get in touch with you over the phone, how would they do that?
That's 668-9196.
All right. Well, ladies, would either of you have anything to add on this topic?
Well, I just think that people can take control of these issues themselves in a lot of ways, and just really kind of changing their attitudes around prescription drugs is key to that. And I think that as a community, you know, we have a great community, and if together we can do that, parents talking to other parents, and community members, you know, understanding and creating that norm that it's not okay to just hold on to prescription meds and share them and such, I think we can make a huge difference.
Great. Thanks so much, ladies.
Thank you.
And thanks to those of you at home. Stick with us. When we come back, we're going to be talking about social and emotional health of our littlest community members.